Oh no,
We
this
have
this
we have to
subject, we cannot touch about this subject
we
because
have to come up we have to have come understanding that before you love yourself, you have to love other people.
okay, I get it. I get it. You know, recently I had another podcast and the subject was about this. So how about if I'm not matching with the society, I cannot cater to society.
You got to match based on the societies that they live, at the same time be able to be productive and useful
My
for
example,
yourself
is
as well as others.
I lived in Iran and I don't believe that society was in harmony with me. Under no circumstances I'm going to be aligned with that society. I'm not
That
going to.
that
So
is your strength. That's your strength.
yeah,
And you have to work to be able to achieve what you want, to be able to get to that freedom that you think is belong to you and you
yeah.
deserve to have it.
Mm.
If you get to that point, then you do everything to be able
I
to
did
realistically to reach to that point. When
realistic.
I decided when I decided to become a psychiatrist, I told you, because
Mm.
I was amazed by this failure of people that have lived with for many, many years,
Mm-hmm.
that they don't know what causing the behavior of the people who have a good intention and
Mm-hmm.
they want to live in a comfortable life, but they
Yeah.
end up with the psychiatric problems in the hospital, which they have to live for the rest of their life.
Mm-hmm.
That was my interest to learn,
Okay.
and that was basis for me to come to the United States to learn psychiatry. In
Mm.
1962, I came to become an intern and then later on psychiatry, and finished the courses of training. At the time that I was offered a very good job, I remember that I was offered the job of the director of mental health in a city of Niagara Falls.
Mm.
Was 250,000 population,
Mm-hmm.
beautiful place.
Mm-hmm.
Niagara Falls was in front of the office that they introduced
Mm-hmm.
to me. When
Mm-hmm.
I was opening the window, the Niagara Falls
Okay.
was in front of me, and they
Mm-hmm.
were willing to pay me good money with the license and everything to practice medicine there. But I
Mm-hmm.
decided, no, I want to go back to Iran.
You want
At
to
the
go back to Iran? Okay.
time, my son was 1 year old,
I see.
and my,
What was the
my
reason that you want to go back to Iran? Am I ask?
because of it was my root in Iran, my
Mm,
family,
mm,
and also my wife was the only child, and she wanted to
mm,
go to be close to her parents.
I see.
That was so valuable to me that I thought I can be a psychiatrist any place in the world that I go to,
Mm, mm,
and Iran was the second choice
mm,
after America.
I see.
And I went there, and for 10 years I was a psychiatrist, very busy, very successful. I'm
Mm,
very happy
okay.
in my life and raising my children, two
Mm,
children.
yes.
And then when I decided to come back, I had to work hard for
Mm,
2 years to be able to get my license. And then after license, I get my visa as a psychiatrist to be in the United States. Who was Iranian, I had to get the American passport,
mm-hmm.
and I had to work hard.
Yeah, of
Never,
course.
never forget those days,
No.
which are very difficult days. But again, I was insistent that I want to do it, and I stay in the course of training as well as accomplishing one after another.
Got it.
Once I was able to get both, I had a job and a position, and I have been working since then. Still to this day, as I told
Very
you,
nice.
I'm working
Mm,
more than full time.
yeah. I know we were touching on the subject of like where do we start, and then so you were saying as long as our emotional needs and is in align with the society's need, and then we got carried away to the subject because we were talking about where do we start? Like if we have childhood trauma, if we have childhood I don't know, like any type of experiences that is affecting who we are today, and we need to seek out help. From where do we start? I want to go back and redirect our conversation there. So let's little bit more talk about the subject, like how do at what point we do know that we need to go out and seek for help.
I think that everybody's condition and situation is different. If you have access to professionals in your environment, which you probably recognize in California, especially, there are a lot of psychologists, a lot of psychiatrists, a lot of professionals in the field. You can really get yourself ready to share your problems with somebody who is specialized in that field. Not everybody who claims that they are specialized.
So will you say the step one will be the acknowledging that, hey, I don't feel good.
Yes, yes.
You know, I don't feel good.
Go to the person who has access to all of the knowledge in this field. I'm not advocating the psychiatrist, but I say somebody who knows about biological, psychological, and societal. Psycho, biological, and societal. That is this really the combination of factors affecting our behavior. First of all, we are born to a family with a history of multiple issues, good as well as bad, positive as well as negative. If there is epilepsy in the family, there is a chance of having epilepsy, if not related to the brain damage or brain trauma. You have to be
raised in a society that affects us,
diabetes or by hypertension or anxiety or depression or OCD, obsessive compulsive behavior. Many people are suffering from this mild form of this problem, never need treatment. If it becomes excessive, which affects your behavior, your life, your relationship, then there is something wrong with the neurotransmitter of the brain as well as your training. If you are born to a mother who is extremely OCD with the cleaning, which was good for the children not to get sick, when it happened in our ancestors, gradually this behavior became normal behavior for some women who be very meticulous in everything they do. It can be partially biological, run to other family members, such as boys and girls. And then when they go to a school, they cannot finish the job because they're preoccupied with perfectionism.
Absolutely.
Being completely,
which affects your relationship, your work, your relationship with people around you. It adds your home. It affect all of it, and without us even knowing, hey, like let's take a look at ourselves back and see, hey, is this obsessive behavior? Is this the effect of certain conditions?
Even chance of getting married or having a boyfriend or a girlfriend, depending on their age at the time, because being so meticulous and everything has to be perfect, you might lose a lot of chances in your life.
True.
I have had counseling for people who had gone to the level of choosing the place of their marriage and then sending invitation to the families to get married to somebody that they had known for some time. But at the last minute, they changed their mind because the decision making was the problem, not the choosing the right person for their marriage,
which comes from the obsessive behavior.
Yes, and they needed guidance.
That's actually a very good subject to explore more, like the obsessive behavior. And then how do we know we have obsessive behavior? And I want to tell you this because I meet lots of CEOs. I live a single life and I see so many successful single people that they're around the late 30s, early 40s, that they have so much obsessive behavior that it holds them back from moving more toward, you know, the direction of success, whatever, like especially personal growth, and is holding us back. So can you elaborate more about this obsessive behavior? And like, what are the examples? How do we know we have obsessive behavior?
I guess we need to have a private session.
Yes.
Once we have a private session, I ask you questions which has to do with your upbringing and also your family background, and you become aware yourself. Oh, by the way, I have lost some opportunities because of being obsessive or perhaps compulsive or being perfectionist. Perfectionistic behavior is good in certain areas, but not
You
in
can
every.
ask me a question. I'm okay to be a patient here because I want to be a good example. I want you to set an example that someone else is listening and says, oh shit, yes, I have the same too. So I do need to seek out help. So let's say I will think I definitely have some obsessive behavior in certain things because I do want to find things like I want things to be perfect. So help me here so I can help my audience better.
Well, I usually do not share with others my clinical experience, especially when it has to do with one particular person, because that is privacy and this is obligation and necessary behavior from me as a psychiatrist to keep everything secret. People who know me, they are aware that how much I would keep their secret as a part of my
No,
obligation.
I just want to
But
like
again,
the
I can give you
example like with
general
OCDs.
information.
Yes.
There are men and women who come in at the time that they are really have to make a decision, which is very important in their life, but the symptoms of anxiety or depression is bothering them. They don't come in to resolve that issue. They come in to get medication because I am the one who can prescribe the medication to them. If they have become more knowledgeable about effective medications available rather than the really airborne medication on the street, on the stores, when they come in, I don't give them the prescription and say, okay, you take this medication, you're going to sleep well, and your anxiety is going to go away, and you go on your life.
No.
I ask them about what it means to you to have this decision made in your life at this time that you are having feeling anxiety over.
Yeah.
So I'm going to talk to you about something which is bothering me for a long time, but is it necessary to talk to you about it? You write me the prescription, I want to leave. But again, I don't give the medication.
Yeah,
there are
absolutely. I'm right there with you.
There are patients who can come to me and I don't give them prescription. I give them the right answer for their problem, and then they decide whether they want to pursue some type of understanding of their problem, and then make a decision, right decision. And then, if necessary, for a few days, I give them medication as well to help them.
Yeah, because the cause is as important. It's just numbing ourselves with the medication. So like maybe if you are a certain, I don't know, psychosis or like emergency situation is different, but just knowing the cause, why I have this anxiety, why I have this obsessive behavior, why I have this depression, why I have this stress is more important to do something, face it, deal with it, than taking medication to numb ourselves.
Now, again, the result is that I find somebody who goes through his challenges of life and decisions that needs to make. And then, of course, the result in a couple of years is having a family and having a couple of children. And now that they are happy, everybody else in the family is happy. I had one experience very important for me to really share with you. One time I was traveling to Europe. I was in the airport, and a young man approached me, had a child in his arm, around his arm, and he came to me and said, "Are you like to Shamie?" I said, "Yes, I am." He said, "I just wanted to thank you for the session that I had with you a long time ago." I said, "I don't remember who you are and what the session was all about." He said, "This child is the result of that session that I was able to make a decision to get married." He came in because of the severe anxiety of the feeling of he might be failing. We reach at times in points in life that we feel that we are going to fail. And that is the time that the person wants to kill himself. I have had patients who came to me and the family brought the person, was an elderly lady around 70, 75. And the family were so scared that she is talking about wanting to kill herself. What should we do? She was there. She was alert. She was coherent. She was able to talk about things in life. And she was saying that, I think that I'm tired of all of these problems in my life. I want to end my life. What I would have done usually, I call the police, say that this patient wants to kill himself, take him to the hospital. If I wasn't aware of the situation, that she had reached the point of breakdown. I told the family what she is having problem is she feels that nobody accepts her, she's lonely, and she feels that she wants to get rid of the pain. This is painful for her to live this life. She doesn't want to die. She wants to live without pain. And emotional pain is much more severe than the physical pain. If somebody has a broken leg, you can empathize with the person, put the person in the cast and wait until the wound is healed. But what do you do with the emotional pain? Emotional breakdown, heart breakdown. We say in Farsi that qalb shikaste is a broken heart. It's emotional. But emotional person who is feeling desperate and feels rejected, wants to kill himself, does not belong to a cardiologist to give the medication for the palpitation. And psychologist has to be a positive psychology. Nowadays, I was really reading an article, positive psychology, which was an article in this magazine, positive psychiatry and introduction to this. This is a new area of psychiatry and psychology, which work together really with experts, that we have to see it and use it as much as possible.
So based on what you said, do you advise when someone is going through stage of their life that they like because of their heartbreaks, because of like so much anxiety at the work, or if they're not feeling well, just not feeling well, so you're suggesting they have to seek help in order to help themselves to come to more stable like emotional stage to be able to make a clear decision for their life?
Of course, there is no question, but they have to reach to that point and be wise enough to choose the right way of handling this. It's very important. We are living in a society that everybody wants to sell their products. Let me put it in a very simple way. Everybody is interested to sell their products. Some products are good for you, some of them are not.
Correct.
You have to choose which product to use.
Correct.
I am hurt and I feel really somewhat helpless when I see people are selling a product that is not useful for some other people who need help, but they are attracted to the product that is not useful for them, and they lose their money, their time and energy, and also the effect of that product is negative many times. I don't want to name, but
Yeah.
again, you have to, when you go to market, you have to know what you want.
Correct.
You don't get anything that is advertised to be sold and put in front of your eyes, because the product that is put in front of your eyes is much less effective than the one that is away from you.
Yeah. Yeah.
Go and find
Yeah.
the right one.
Yeah. Yeah.